So for the people that don't know or stumble upon this video who do not follow me on my channel, I'm here to tell you guys and gals I'm in my scrubs and I do work in a hospital. I'm a frontline healthcare worker. For my subscribers, it's a little bit repetitive information, but I do need to give my background quickly because it's relevant to this discussion. And I want to give you my reasons, and I might stir the pot a little bit with this, but so what, right? I got to speak my mind, and I want to give you my reason as to why I believe that healthcare workers should not demand extra hazard pay or extra compensation during COVID-19. Me being a healthcare worker, I feel like, at least, even if you may disagree with me, by me being on the front line and having this opposing view, it holds a little bit more validity. And even though I may get some criticism, I probably won't be as criticized if I wasn't a healthcare worker. Because if you think about it, if I wasn't a healthcare worker and I was saying this, it can come off as more insensitive, and the person who doesn't agree with my argument would just say, oh, this guy doesn't work in a hospital, he's just being an ass. But the fact that I do work at a hospital and I have this opposing view definitely, hopefully, will hold some validity. Anyway, the reason why I don't believe that healthcare workers, medical field, healthcare in general, such as myself, should not get extra pay during COVID is because this is what we signed up for. Just like any police officer who signs up for law enforcement, who gets into law enforcement, just like a firefighter, a fireman, especially I live in California, during the wildfires, you're going to have times where things are not going to be normal. So let's say, I'm not a police officer, obviously I don't know nothing about it, but let's say an average day, average work day for a police officer, they do their patrolling, they go to lunch, they take their hour lunch, they give a couple of tickets, they get a couple of calls. But let's say it was the 1992 LA riots and things were getting out of control. There's going to be a lot more stress and a lot more hours that you got to put in. Same thing with firemen and firefighters, especially during the California wildfires, which typically happens like every year now, unfortunately. And these guys are working overtime. And to demand extra pay, it's part of the job duty. Now there isn't a small exception. Now I can't speak for everyone, but in my sector and where I work at my hospital, we get paid hourly anyway. So if I was a salaried worker and then I was working tons of extra hours and not getting compensated for it, that could be understandable. But for this group of people, the medical professionals that are bitching and complaining about wanting to get extra pay, I would venture to guess that the majority of them are getting paid hourly. So they're not only getting paid during a crisis, but they're also getting compensation with overtime, which is usually time and a half. So that's pretty good. And also, you should be lucky that you even have a job, because unfortunately, with millions of Americans that are unemployed, especially the small business owners, the salon owners, the gym owners getting all shut down with these draconian measures, they're the ones that are getting the majority of the heat. The other aspect that influences my my perspective on this and where I stand is, not to get too much off a tangent, but I think you guys, my subscribers, already know that, and I have data to back it up, that the case numbers are inflated. The number of deaths, the difference between dying with versus from the virus, it has not been differentiated, and it's completely blown out of proportion. So that's probably another reason. But even so, even if I believe that this COVID-19 was extremely, extremely deadly, I would be a little bit more apprehensive, which I'm not. I would take more precautions and I would feel more pressure, but I still, from the bottom of my heart, I wouldn't expect more pay, with the exception of if I was a salaried worker. So anyways, I just want to give you my thoughts on that. It's probably not a popular opinion, but I try to put things into perspective. And to demand more pay when it's part of your job description, to me it just doesn't make sense. So let me know your guys and gals' thoughts. Oh, and I will say, but if you've gotten this far in this video, if the pay's there and they give it to me, hey, I'm not going to pass up free money. I'll put it that way. I'll, if I get that extra money, you can, help someone else out, another business owner, if I have that extra money, and I've been trying to do that during these tough times for people, trying to give a little bit more tips and stuff, I will allocate that money if I get the extra pay. But I'm not going to go out of my way to start a Facebook group or demand I'm not going to start a Facebook group and cause a lot of hoopla over this, because it's just my job and that's what I do. And if I don't like it, I can get out of the profession. No one's putting a gun to my head. No one's forcing me to stay in this profession. I'm here to, number one duty is to help my patients, my cancer patients, in the most efficient and accurate and way possible. And that's just what I signed up for. Thanks for watching. Let me know you guys and gals' thoughts. And talk to you later. Bye.